what's this actually got to do with research? Well, without commencing the research that I did over 20 years ago, I certainly wouldn't be here today. And by researching a topic which didn't fit the usual mould, so it wasn't, lab, it wasn't white coat stuff, it wasn't trying to cure cancer, you soon become a relative expert in the field. So to this day, there aren't a lot of articles, apart from Bruening and Maddern, talking about rural surgery. And so, by taking something which is, not fashionable and admittedly having a bit of an interest in it, you can become an expert. And this is, for me, this is kind of continued with research and supervising people doing PhDs in topics outside the norm. So at the Queen Elizabeth, we've had a lot of work done on surgical coaching that some of you might be aware of. So that's the concept that if I finish my fellowship, technically speaking, no one assesses my work after that point in time. I mean, I know there's clinical audit and all that sort of thing, but really I can keep doing the same thing for the next 40 years. So the whole concept of surgical coaching where, a peer will say, well, you could have done this a bit better, or why don't you try doing this, or it's a new concept. It requires, a bit of work and input, but, that may well be a thing of the future. The other thing that we're doing at the Queen Elizabeth, which is once again outside the norm, is trying to change the whole ward round. I don't know about you, but the ward round's chaos. You got 10 people on a consultant ward round, 5 people are having a separate conversation. The nurse comes in to ask about the last patient you saw. Patients just in the bed thinking, what the hell's going on? So it's chaos, and when you think that that's the most important part of the day, where decisions get made for the whole day, discharge, operation, investigations, whatever, can we do this better? So we're currently doing a study on the sterile cockpit, which is from the aviation industry. We've just got a couple of people doing the main ward round, nobody disturbs them, and we just see how much more effective that could possibly be. So once again, it's not a topic that is, the sexy, hardcore sort of thing, but nonetheless, it's important. And, the college, what Mr. Anthony's pointed out about the whole, all the various things that we have to think about now. I mean, 20 years ago, people would have laughed at you if you said, oh, non-operative surgical skills are important. And now it's really important. They have exactly the same impetus and importance as actual technical ability. So everything changes.